take it from my perspective as a physician, because when I look at the disease objectively, I know what's going on in the brain of these people. And so I have a pretty good idea of what I was looking for in terms of how I felt I would want her to be taken care of. First of all, I would look at the nature of the staff that was there. To me, that's crucially important. The staff people have to be caring, they have to have an attitude of compassion, and they have to understand and have, at least in some fashion, been educated on cognitive impairment, which is the medical jargon for Alzheimer's disease, among others. And for me, that was primary. And the question then always is going to be, well, how do I find that out as a layperson, a non-physician? And I think it's a matter of interviewing the person who is in charge of the unit, generally going to be a nurse, a registered nurse, I would hope, to see if that person really understands what the disease is all about and how one cares for these people on a day-to-day basis, and how that person would instruct the staff that he or she is in charge of. For example, I know the chief nurse here very well. Having served on these committees and stuff like that, I got to know that can I use names?
Absolutely.
Yeah, I got to know Sherry Waite quite well, and I would say that she is about as expert as anybody can be from a nursing standpoint about how these people are, what their progression is, and things of that sort. On the other hand, the nurse in charge of the unit, who is Linda, and I can't remember her last name,
Davies.
Linda Davies, again, comes from that same ilk of knowing what the disease is all about, and then understanding and instructing the rest of the staff. They don't all have to be expert, but they have to be understanding and caring, and that's so important.